Primary health care is rooted in a commitment to social justice and equity, as well as the recognition of the fundamental rights to the highest attainable standard of health as echoed in Article 25 of the Universal Declaration on Human Rights, which reads, "Everyone has the right to a standard of living adequate for the health and well-being of himself and his family, including food, clothing, housing, medical care, and necessary social services." According to a report from the World Health Organization's website, about 100 million people are pushed into extreme poverty each year due to out-of-pocket spending on health, while at least half of the people in the world do not receive the health services they need. Primary health care is the first point of contact for people should they experience illness, and it is expected to be affordably accessible so that the very poor are not excluded. Is this the case at the primary health care facilities in Abuja? What are the services provided in the primary health care centers? What about timely intervention by health personnel at such facilities to save the lives of patients if and when needed? We begin our investigation at the Primary Health Care Center under the Abuja Municipal Area Council in an unnamed suburb in Abuja. The path leading to the Primary Health Care Center has been further worsened by the rains. The mini banner outside the facility lists several services provided here. This gives hope, but we were soon to find out that this is not the case. The security post is unmanned, giving unhindered access to the clinic. The reception area too is unmanned, with a patient's files on full display in the dirty floored center. We hear chattering in the nurses' station. After a while, a cleaner sweeps, and I'm still seated as time passes. What if I was a patient who couldn't speak and was dying? What if I was someone that shouldn't have had access to the clinic in the first place? According to written text on the type of primary health care centers, this primary health care facility has the semblance of the Type 2 health center, which has more staff and more beds, usually for admission for maternity cases and additional beds for temporary admission of acute cases. The Type 2 health care facility is usually headed by a community health officer or an experienced nurse. Services available in the Type 2 Health Center include initial management of complicated pregnancies, diagnosis and treatment of common health problems, school services, and disease control. Approximately 50 minutes later, the receptionist surfaces from the inner room and asks if I was there to see someone. I pose as a patient and a file is opened in my name. After the necessary payments and documentations, I am sent to see the doctor for a general checkup. The doctor recommends a series of tests and adds that the one he knows I am most interested in is the HIV test, but that the kits are not available. Prejudice in medical practice, you may say. With the tests amounting to a couple of thousands and the receptionist refusing a transfer, I opt to return at a later date for the tests. On this day, I arrive as early as possible. I arrive at the primary healthcare center at some minutes to 7 a.m. with the goal of seeing how services are very early in the morning. I encounter an elderly man who is somewhat of a security man at the gate who directs me to the reception area. The clinic is filled with mothers, each carrying their babies. Looks of dejection and hopelessness are evident on some faces. Where are the nurses? Where is the doctor? In a 2018 report by Premium Times, an official of the Federal Capital Territory Primary Healthcare Development Board had said about 50 primary healthcare centers would begin 24 hours operation. But it appears this particular primary healthcare center is not included in the 50. The elderly man comes back inside the clinic from the gate area and appears familiar with some mothers as they banter and laugh. Baba, as he is called by the mothers, gives out numbers during the work of a receptionist at the same time. I was later told by the mother seated close to me that this was the order by which the babies will be immunized, but the doctors and nurses are still nowhere in sight. At about 8:48 a.m., a nurse strolls in leisurely. Some minutes later, another strolls in. The mother seated close to me tells me that this is what they go through on a regular basis.
For me, I'm used to it. If I have money, I won't come. I will go to another district. I put on then I tend to pick. I don't have.
She also adds that her hope is in God alone, as no one has been able to give her the true diagnosis of what is wrong with his son. She adds that she would have gone to another primary healthcare center if she had the money. To which I ask if the services here are free for the children.
I collected a card 200. I did a test, typhoid and malaria 1,000. And the drugs they wrote for me is 2,500. So it's cheaper compared to private.
And to that she replied that it is more affordable compared to the other one just 10 minutes away due to transportation costs through and fro. I decided within me that I will check out to compare and see things for myself. In the meantime, the nurses begin the praise and worship session and are joined by the mother. Exactly 9:25 a.m., the doctor drives in. It is a different doctor today, and it is soon my turn to see her. This time, I identify a specific problem, but what she does next leaves me bewildered. A doctor at a government-owned facility sends me for investigation at a private laboratory using the investigation leaflets of the private laboratory. The doctor directs me back to the elderly man at the gate to direct me to the private laboratory. He writes down a number for me and proceeds to hail a motorcycle rider, whom he gives directions. This is apparently the norm here. From the private laboratory, I proceed to the primary healthcare center the mother seated close to me had mentioned earlier to see what I could find there. Here it is a beehive of activities, but the reception is no different from the previous one. No one asks questions as I take a seat. I make sure 30 minutes pass. Within that time, I notice the facility has more equipment, a functional laboratory and a functional pharmacy, in contrast to the first facility. I then approach the nurses' station and in sharp contrast with the first primary healthcare center, after necessary documentation and payments, my vital signs are taken as a file is opened. I see the doctor and am sent to the laboratory for blood tests. What stands out here again is that 3 different tests in the facility cost half the price of only one test at the private laboratory. The lab technician uses no protective gear while attending to me, exposing the both of us to risks of infectious diseases. After 30 minutes, the results are ready. Thankfully, nothing is found. On this day, I returned to the private laboratory. This time in the company of a cameraman to seek answers to questions I have. Startled by the presence of a camera, and to my surprise, the attendant sings. Inaudible from the clip, the attendant reveals to us that they share a percentage with the doctors who send in patients for tests from their primary healthcare centers. This grossly defeats the aim of affordability for primary healthcare. Armed with this finding, I return to the doctor and I introduce myself as a journalist who is carrying out research on primary healthcare centers. She politely states that they are only able to speak with journalists and researchers who have permission from their employers, which is the Abuja Municipal Area Council. I am met with the same answer at the second primary healthcare center, whose staff at the entrance become aggressive upon sighting the camera. Now, this became the beginning of my being tossed around from one office to the other. First, I went to the Department of Health Services, where I asked to speak with the Director of Primary Healthcare Centers. I was then asked to get approval from the Primary Healthcare Development Board. From the FCT Primary Healthcare Development Board to the AMAG Primary Healthcare Development Board, no one could agree they were in the position to grant the approval. I returned to the office after several futile attempts and got a letter addressed directly to the AMAG chairman, which I then took to the Abuja Municipal Area Council, AMAC, to get approval. The letter is minuted to the Chief Press Secretary, whom I am unable to get hold of due to the leadership crisis in the council. The new chairman was caught up in a court case to determine who the rightful winner of the council's election was. I finally succeed after several attempts, and he is of the view that the director of the primary healthcare centers, as a new appointee, is not suited to respond to my findings, and then directs me to the supervisory council on special duties. On this day, I start by asking the supervisory councillor on special duties, Mr. Emmanuel Inyang, what the administration met on ground as regards the primary healthcare centers.
For us as a council, since we came in, we've been able to ensure that activities in collaboration with the Supervisory Councillor for Health and also the Head of Department of Health, we are all synergizing to ensure that everything that has to do with health, not just health alone, even in other sectors. The council have a very huge number of health centers in most of the hinterlands, and those health centers have doctors who also attend to patients whenever they come. And the purpose of all of this is to reduce burden and tension on the secondary health centers that are already there, because if at the primary health center, people are easily taken care of, like the minor ailments and all of that, there will be no need to further to the secondary. And that on its own too will reduce costs, will reduce a lot of hardship that the people would have gone through in assessing that of the secondary health centers when they can easily assess that of the primary health center.
I then confronted him with the realities on ground at the primary healthcare centers. I undertook the investigation, and this is what he had to say.
We are not aware, and now that it has been brought to our notice, I want to assure you, maybe, hopefully, and I strongly believe you also give us further information to enable us to do the needful. And it might not just be that health center alone that is involved in what you've just said. That is an eye-opener to other area health centers, because you also help us to go further, to also carry out our in-depth studies of activities and actions that are ongoing. And we will also, on our own, like you said, carry out visits to some of these health centers, not informing them that we are coming, most especially on odd days where they will never expect government officials at the top to be there. Well, I will quickly draw the attention of the Supervisory Councillor for Health, who was here with me a while ago. I will draw his attention immediately, and like I said, I will plead with you to also give us further information to enable us know where to start from. I am not doubting you. Neither am I saying yes or no, but we will immediately undertake investigations to these health centers you've mentioned and other ones, because it might not be just one place. And this sharp practice that you've just mentioned is not just peculiar to health centers. Even in most of our government secondary health centers, they refer patients to their own private hospitals.
Some respondents also spoke about their experiences with primary healthcare centers in Abuja and recommend ways to improve services at the primary healthcare centers.
I was able to get them at the hospital, but some of the drugs were not there. I had to go outside to buy. And again, the lab is okay, but I think it still needs to be upgraded so that they can meet to the standard. Because there are occasions where before you start going to other hospital, get your test and come back, maybe the situation might be worse. But if they can be upgraded to that extent, I think it will go a long way in helping the locals around.
The primary healthcare that I've visited before, and I discovered some challenges, such as they lack some facilities, the medical facilities that they need within the clinics. They really lack them, which I really want government to come in if they can help to support them, so that they can attend to immediate health challenges within the communities. And the other second one I discovered was staff. I have in contact with some of the staff there, and some of them are casual staffs. They are not permanent staffs. They are just been volunteers for like some years, some 3 years, 4 years, 5 years, 8 years, and I say, oh wow. Then they are working hard. Which I see if government can be able to permanent them, I think that one is a good one too.
The facilities are really not, some of them are not conducive, but yet you still see them working there. Some of them need equipments. Some of the equipments are obsolete, which need to be upgraded.
With the assurances from the Supervisory Councillor on special duties at the Abuja Municipal Area Council, it is only hoped that facilities and personnel who do not live up to the standards required of primary healthcare centers will be monitored and punitive measures put in place for erring personnel so as to improve the services available to the common man who is mostly at the receiving end.